So, hello everyone. I'm sitting here with Giulio Corbelli, who's chair of the European Community Advisory Board of the European AIDS Treatment Group, ATG, and he was also sitting on the community as community representative on the scientific board of this particular conference, the 2016 Glasgow HIV Drug Therapy Congress. And this is what we will talk about a little bit. Giulio, what about this conference? How did you like it? Was it a good one? Was it useful? What was good? What was bad?
I think people know that this is a kind of a particular conference because it is a one-track congress, so everybody's in the same room discussing topics that you can network after, and you can just discuss that specific topic with anyone you meet. And this is a great opportunity because it's a kind of unique way to interact between community and researchers about a specific topic, which is drug therapy. My impression is that this year, the conference was able to focus exactly on treatment. There are still some issues we should understand. We have new treatment options, even newer treatment options coming in the future, but with the existing ones, we can learn how to use them better now. And there were some very interesting abstracts presented here, which can explain how to use better, for example, dolutegravir, or also what the added value of the new version of tenofovir. All these issues are very relevant for us people living with HIV because it's part of our daily life to take drugs and to try and live as better as possible with them, as you know.
So if you think about all the presentations that we heard during this conference and also the posters and abstracts, what do you think is the main new direction? What is the most important trend that we should watch as communities of people living with HIV?
Okay, I think that as per the treatment options, the treatment strategies, we are looking into safer and more convenient strategies, regimens in general. We have these new drugs coming. The dolutegravir is already here, but the new version of tenofovir TAF and also other drugs in pipeline, which seems to be very safe, very reduce the burden of side effects, and are easy to take. But there are also some new strategies, the long-acting combination, for example, or long-acting formulations, which can design a complete new landscape in HIV treatment, because we don't know how it is to live with HIV having just one injection per month, or even every 2 months, or even in two injections per year, maybe in the near future. So I think that these are the strategies we should look at very intensely, because they are quite interesting. They are affecting our lives. On the other hand, there are some interesting research and studies going on also trying to address the persistence of HIV in people infected with the virus. We are very far from finding a cure, that this must be said clearly, but we are working on that, and that's an important news. Also because we need to have community involvement in this kind of research. I'm afraid that especially the cure research, the HIV cure research going on in Europe, who needs more involvement from the community. Also to do better study, more convenient for the people who can address the issues. There are so many questions related to the ethical issues, but also the implementation issues when talking about the HIV cure research. So we should give our contribute there.
You also chaired the community cure session or workshop, which is about long-term remission, as we call it, or the cure of HIV. So you say that it's a long way down before we get to a cure, but how long do you estimate this road to be? So how long does it take to find a cure in your view?
No, I will not give you any timeline, because the, there have been so many announcements in the past about we will have a vaccine in 5 years, in 3 years, even in the early 80s. We were so confident to have a vaccine very soon. So I will not give any timeline. I was hearing today Steve Deeks saying that in 5 years we should have some combination strategies ready to start the clinical development.
All right.
So we are now in a phase where we are trying to understand how a single intervention works, what kind of results can produce. We know for certain that no single intervention will be able to cure HIV. So we will need to combine diverse strategies, diverse interventions to find valuable solution, probably. But now we have at least 5 years, according to Steve Deeks, I don't know, to evaluate this single intervention. And then in 5 years we will be able to combine them and to start the development program to see whether it works. So.
Thank you, Giulio. I think that this was it, and good luck to you for your closing statement of the conference.
Thank you.
And I hope to keep all of you updated in the coming weeks and months about whatever development is going on. Thank you.